California State Senate passed a bill last night that could result in a doctor's state license being revoked if they spread false or misleading medical information about COVID vaccines or treatments.
This is totally insane. What qualifies as misinformation?
One time's disinformation, misinformation is another time's scientific consensus. There is no the science.
I really think you're going to need doctors who are willing to take a stand and go down swinging. Either that or you got to leave. You got to leave the state of California.
AB 2098 tells the California Medical Board to discipline doctors who spread so-called misinformation to patients about COVID-19.
My name is Aaron Cariotti. I've been practicing medicine for 20 years.
My name is Azadeh Khatibi. I'm a physician, but I'm also a patient. When I found out about AB 2098, I was very concerned. The legislature of California, Governor Newsom, and their zeal to promote certain narratives has now come in to try to control doctors and their speech in a very dangerous way.
AB 2098 will have a chilling effect on the ability of physicians to engage in open and honest conversation and discussion about COVID with their patients.
The law defines misinformation as false information that contradicts the contemporary scientific consensus contrary to the standard of care.
The law in California threatens doctors for giving their honest opinion, threatening them with loss of their license that they worked so hard for.
I looked at the word consensus and immediately said, what's consensus? Are we talking about formal consensus or informal consensus?
Because AB 2098 is difficult to interpret for physicians, physicians are going to err on the side of just reading from a script written by the California Department of Public Health.
Discussion, disagreement, and debate. That's actually quite healthy because that's how science and medical knowledge advances. That's how patients actually get the best care, ultimately.
What we're seeing these days is really unprecedented government interference in speech when it comes to dissenting voices on COVID-19.
A physician with a gag order is not a physician that you can trust. When a government is not authentically representing the will of the people, then it's time for the people to push back against government overreach.
Even in the middle of a pandemic, the state can't violate the First Amendment. NCLA brought this case because we're concerned about the increasing degradation of First Amendment rights.
I'm very encouraged that the judge in our case has granted our request for a preliminary injunction. This established two things. Number one, that the 5 physicians bringing this suit all have standing to bring the suit. And number two, the court was indicating that we have a high likelihood of succeeding on the merits of the case even before the case goes to trial.
This is abnormal. This is wrong. I'm going to do everything in my power to fight this type of injustice against doctors and patients. I'm just getting started.